G'day, Jeremy from TACMed Australia. Well, spring is well and truly in season right now, and that means the snakes are about. So today I'm going to show you the pressure immobilisation technique using the new Snakebite bandage from Aero Healthcare. Alright, to apply a pressure immobilisation technique to a snakebite victim, we're going to need a few things. We're going to need our snakebite bandage. In this case, we've got the snakebite bandage from Aero. We're going to need a splint of some form. Obviously the SAM splints, the Aero splints are ideal. If not, we can use magazines, newspapers, we can use sticks, anything you can find to mobilise that limb. We're then going to need something to secure that immobilisation as well. So this one, I've just got some Coban for that. And we're also going to need a pen or a Sharpie to mark the site on where the snake bite is. Okay, so I've got Jen here, she's been bitten by a snake. Okay, firstly, something important, we won't do it in this case, but if we've got any rings or watches, we need to remove them, okay? A lot of the time we can have swelling of the limb, and if we've got rings on, we could lose that digit. So remove any limbs. So the snake's bitten Jen on her wrist there, so we're gonna get our bandage, and we're just gonna do a couple of wraps directly over that site. So we wanna tighten that bandage so these rectangles become squares, okay? We don't wanna do a tourniquet. And we're going to go down that limb and we're going to mark. Going to mark where that bite is. Okay, all the way as far as you go. I'm just going to leave her fingertips exposed so that way we're able to assess the circulation and it's not too tight. Okay, I'm going over half the bandage at every wrap. And then as I've gone over that bite site, again, I'm just going to mark the site. The reason we mark that site is that when the patient's taken to hospital, they can do a swab to test what the type of venom is. And a lot of the time they'll just cut a square out of that area or swab underneath that bandage. So they won't remove the bandage at all when they do the swabs. So we're just going to continue going up the limb as high as we go. And that's the good thing about this new snakebite bandage from Aero, it's that it goes to 10 meters in length when it's stretched. So that's, instead of using 2 or 3 bandages on someone tall, you can just get it all done with the one bandage. It's good that under the adrenaline we know exactly how tight we can do this as well with these squares. So normally I'd have Jen laying down flat on the ground, but obviously for the purpose of this video, it'd be a little bit hard to do. So that's it. I'm then just going to either tape this down or just tuck it underneath there. So it's really important to keep the patient nice and still, okay? So because the venom moves through the lymphatic system, we don't want them moving around because that's going to pump the venom up into the rest of the body. We're then going to splint this limb. Alright, so we've splintered the limb. We're going to keep Jen nice and still. Notice there I've kept her fingers out there so I can just test that capillary refill, and that's still filling up in less than 2 seconds, so we know we haven't cut off circulation. We also know that because we've got our identification squares there, and I can also place my finger under the bandage. It's quite firm, but I'm able to easily get a finger under there, so it's a good strength to slow down the lymphatic flow and therefore the venom, but not tight enough that it's going to cut off circulation. Obviously, we then monitor the patient closely and need to evacuate her to an ambulance or a hospital, okay? Constantly reassessing her vital signs. And that's it, that's the pressure immobilisation technique using the Aero Snakebite bandage. Thanks for watching.